get out of the way and you can take it away.
Okay. So my presentation today is a little bit old, but it's related to what we currently are in sleep today. It's from the National Sleep Foundation. So it's just a basic foundation of sleep, getting you to understand the importance of sleep and what you should be seeing a physician for if you have sleep disorders. Okay, so what we're going to learn today, the importance and benefits of your sleep, the states and the stages of our sleep cycles, the sleep needs, the patterns, the characteristics for all ages, the sleep deprivation and its consequences, prevalence, symptoms, and risks associated with major sleep problems and disorders, and healthy sleep tips. Okay? Why is sleep important? Why do you think sleep is important? I know we have some things up here, but how many of you in this room have really good sleep? Or think you have really good sleep? Okay. So all of you, not really, you don't have good sleep either? Okay. Well, guys, I hate to tell you this, but sleep is so crucial to our lives, okay? It helps you with your performance during your day. It helps you keep alert. It could help you with your, if you have depression, it'll help you with stuff like that. It's an essential component, just like nutrition and exercises, so I want you to remember that. And let's see here. Sleep is regulated by two body systems, your sleep-wake restorative process and your circadian rhythm, okay? Sleep and wake, it's when you're sleeping and when you're awake. Your circadian rhythm is different because it's regulating your sleep time, okay? How many of you, when you're working, how many of you work 8 to 5?
8 to 6:30.
8 to 6:30 is close. The last couple of hours of your shift, how do you feel?
Wiped out.
Depends on the
Tired.
day.
It is normal to have a mid-afternoon dip, as you can see in here, and that's kind of like our circadian rhythm. Sandy's pulling up something to eat here.
Okay, sugar.
Our circadian rhythm is controlled by our eye and light, okay? It's that retinohypothalamic tract, it's called. And those of you that work during the day, we have a normal sleep pattern. But those of you that do night shift, how many do night shift in here? Anybody? Okay.
Did it for a long time.
Yeah, sleep techs, that's their normal. They actually have a sleep disorder. It's called shift work disorder. And it's when your eyes are they're not really adapting to the light. So your brain and your eyes are not sure when to sleep. So shift work disorder is the potential of telling the brain doesn't know when to sleep. Our sleep cycles, we have stage 1, stage 2, stage 3, and we have a REM stage. Because this was copyrighted in 2003, it says stage 1 through 4. We only have stage 1 through 3 now, and a REM sleep, okay? Your stage 1 is when you are transitioning from being awake to your sleep. Stage 2 is stage 2 is when you do 50% of your night in that stage. Stage 3 is when your brain activity starts to really slow down. You get really, really into a deep, deep sleep. You can have a train drive through your bedroom. You won't hear it. It's that deep of sleep. And then you have your REM sleep, which is your dream stage, okay? These are what the stages of sleep look like as you're a sleep tech. And I don't know if I can get in front of you. This is stage 1. See how fast and kind of bunched together those waveforms are? This is when your brain waves are slowing down and it's headed into a nice sleep. Stage 2 is when the brain waves start to loosen up a little bit, and you got what these are called sleep spindles we look for. It's like a bunch of sleep waves all together, and then this large kick that we call a K complex. And then in stage 3 and 4, it's combined now. This is where your brain waves slow down, and it's hard to wake you up during that sleep. And actually what's really nice too is your breathing patterns become very, how do we want to call it? Very regulated, yeah.
So
Mhm.
the kick at the end of stage 2 is at the beginning of stage 3? Is it the same?
Nope, this is what you'll see continuously through stage 2. That's a very good question, because they look very similar, don't they? Yeah. But this is what you continuously see, and then you have to see at least, I forgot it, it's a scoring rule, because I'm not a sleep tech anymore. It's 6 waves to be,
For every 30 seconds.
So if you count 6 of these, that's what guarantees you stage 3 and 4. This is your REM sleep. This is when you have that active eye movements. How many see your animals moving their eyes and grunting in their sleep, and they have a weird breathing pattern? That is what happens in REM sleep.
You dream in REM?
You dream in REM. You can, you don't have to dream in REM, but that's where everybody does their dreaming. Yeah. During your sleep cycles, your body temperature drops. How many wake up in the middle of the night and put a blanket on because they're cold? That is normal. Okay. Your hormone levels actually kind of fluctuate kind of weird in the middle of the night. If you are going to bed late, your growth hormone is released in your sleep. So they say the best time to go to sleep is probably around 10 o'clock. So your growth hormone spikes and then goes till about 1 o'clock in the morning. In your melatonin, it's kind of sporadic and all over the place there. Why do we need consolidated sleep? Well, it's the way you have a, excuse me, sorry. It helps you with your performance. It helps you stay alert when you're driving. Helps you from falling asleep during a lecture like this. Try to make sure you're all awake. Huh? It also helps your memory.
Excuse me,
Yes.
we need somebody let in. Katie's just came.
It's 2 of us.
Oh, yes, it does.
This helps you, it helps you with your memory. How many people have a really, really busy day at work and then they're like, I can't take anything else in? The same thing, if you don't get enough sleep, that's how you're going to start your day. So a lot of our patients that come into the sleep center, they all have a lot of symptoms that are similar, like memory loss. They have high blood pressure and low concentration. Yeah, it's a lot of it. Now here is something very interesting that newborns, they need 15 hours of sleep. Anywhere from when they're 2 months old, they need about 18 hours of sleep. When they get to be about a year old, they need about 15 hours of sleep. As they become a toddler till about 12 years old, they can need anywhere from 10 to 15 hours of sleep. It just depends on the age. Adolescents, they need 9.5. And adults average between 7 to 9. Now, you may think 7 to 9 is a lot of hours of sleep, and I never get that. That's average. You got to think about that. Some people can do without 5 hours, can only do with 5 hours of sleep. I don't know how they do it. I need 7 to 8, or I will not function the way I should. So, newborns and infants, as some of you may already know, they're more active in their sleep. They have 50% of REM, which us adults, we have 25%. Am I accurate? 25%. Okay. They have several periods of sleep. That's why they nap all the time. Toddlers, their sleep resembles an adult pattern, but they're the ones that need the naps during the day. Children, they have more deep sleep. That's why it's harder to wake a child up. They have more stage 3 and 4. Those are studies that are those big waveforms those are hard to score sometimes as a tech. So, adults, they need regular, they want to be more regular. So they need to go to sleep at the same time, wake up at the same time, and if you're not doing that, it changes your day. It changes your moods even. And as you grow older, your sleep becomes more disruptive. And then sleep disorders begin. Are we getting enough sleep? I don't think in this room we are. It doesn't sound like it. So 39% back in 2003 of Americans are not getting that 7 to 9 hours recommended optimal health. In our experience, that's still pretty regular. That number has not really changed. 74% experience sleep problems that affect the quality of their sleep. So we have a lot of people out there that have like sleep apnea, insomnia, narcolepsy that don't even really know that they have it. Excessive daytime sleepiness. 37% of our Americans, they have sleepiness and it interferes in their daily life. Several things that your memory is impaired when your sleep is not consolidated. It's harder to pay attention. That's always been my problem. Your mood, you can be in a really horrible mood or very hard to approach. Over a half of adults report that sleepiness makes it hard to concentrate and solve problems. Safety is also compromised. There were 100,000 back in 2003. There were 100,000 sleep-related crashes per year. That's an astronomical number to me. 1,500 fatalities, guys, and 71,000 injuries. It's crazy. 51% of adults report driving drowsy. 17% dozed off at the wheel. They say now that drowsy driving is just as bad as a DUI. And I think in the near future, they're going to start cracking down on it more and more. It'll be interesting in the next 10 years what's going to happen.
They are for truck drivers.
Yeah, they're making truck drivers more responsible. Yeah. So when you're tired and you're working a long shift, please be careful. Get someone to drive you home or take a 10-minute nap. 10-minute nap can restore a lot. Health consequences of inadequate or poor sleep. Body systems associated with major diseases such as diabetes function less effectively. Hormonal changes can accelerate and pouch process. I'm sorry, I'm reading word for word here, but it leads to obesity. If you're tired all the time, you have a hard time with getting up out of bed to exercise, that's my problem. You know, if you are getting enough sleep, you could get more energy and you could possibly exercise every day. Common circadian disruptive diseases. There's shift work, which I already brought up earlier, and jet lag. How many people fly across the United States and have, yeah. The older you get, the harder it is too. Yeah. It's really something to get back in your regular sleep pattern. They say when you travel, our doctors really try to ask the person to keep the same schedule as you do on your shift. And that's not easy when you're going across to another country that's 6 hours time zone. Yeah, oh, that's really, really hard. Yeah. Recognizing sleep disorders. Snoring loudly, You or others have observed you stop breathing or you're gasping for air during your sleep. Feeling sleepy and you're dozing off while you're just watching TV or having a conversation with somebody. People do that. Having difficulty sleeping 3 nights in a row. Feeling unpleasant, tingling, creepy feelings in your legs. Has anyone ever felt that? Where you're just, it's annoying. There's this feeling that won't get out of your legs and you can't, you have to get up to walk around.
I think they named it restless.
It is, it's restless leg syndrome. Very good, very good. Interruptions to your sleep, like heartburn, bad dreams, pain, discomfort, noise, sleep difficulties.
Babies.
Babies, yeah. Our sleep center can't hook you with that. Anyway, insomnia is a sleep disorder that is common when people come in to see a sleep doctor here at Peace Health anyway. It's inadequate, poor quality of sleep, difficulty falling asleep, frequent awakenings during the night, waking up too early and you can't go back to sleep, unrefreshed, non-restorative sleep. The prevalence of insomnia, approximately 40% of American adults experience occasional insomnia, 10 to 15% on a chronic basis. The most at risk are women, older adults, and depressed people. And a side note, a lot of people come in with insomnia as a symptom, and it turns out that it is not really the case. It could be, but in order for us to figure that out is by seeing the doctor. So this is, insomnia is a perception sometimes too. So, cause of the types of insomnia. There's an acute, there's chronic, and then there's a primary. The acute is jet lag, emotional stress, something going on in the family, and it keeps you up at night, work, something stressful at work. That's an acute setting of it. A chronic could be medical, psychiatric, anything environmental too, somewhere where you're living you don't know what's going on, that could cause it. Primary, we don't have an association, and it only lasts about less than a month. Treatment of insomnia. So we can do drug treatment. Over-the-counter drug that our providers like to use is Benadryl. Melatonin is another one. Thank you very much, Alicia. Melatonin is really good. And I'm trying to think, is there anything else? There are some over-the-counter that I don't really know if they work really well. It's the NyQuil. They have NyQuil out there. Z-Quil, yeah. So those kinds of things are worth trying before. Yeah, Tylenol PM. Those are worth trying. They do have prescriptions that they have is Ambien. What else do we have? Lunesta. Lunesta has a bad taste. It leaves a bad taste in people's mouth, but it works really well. Trazodone. Some of the anxiety medications are used for sleep as well. And you know, a lot of the providers that use the anxiety medications, like what were you calling that? What drug is it? Trazodone. Trazodone, it suppresses REM sleep. Okay, so people that have really bad nightmares or suffer from post-traumatic stress, our doctors would give something like that to somebody so they don't hit their dream stage as frequently or wait later in the morning hours. Behavioral management is what we really try to do with the patient that has insomnia, because it most likely is just their behavior that causes the insomnia. So the doctor will work with you on your start time and your wake up time and try to get it as consistent as possible.
I think the big one is no TV in the bedroom.
Yes.
Don't use the bedroom for anything but
computers,
sex
no
and sleep.
phones.
That's what our doctor says.
That is,
what
and
it
that's,
says.
and that's not a joke, really. I mean, before I became a sleep tech, I was like, I cannot go to sleep without my TV. And I like to listen to TV or just background noise. And a lot of our patients are like that, and they kind of fight us on that. But they have a better sleep quality that night when you don't have that distraction. A lot of people like it for the comfort, I think, more than it is for the for the sleep. Knowing you have something in the background is
How about like
nice.
white noise?
White noise works. We allow that, don't we? Yeah,
That's
white
got
noise.
like a fan or.
That's what I use.
Our CPAP machines can be considered white noise.
Oh,
Yeah, they
I
hum
don't.
a little bit. Some make no
Depends on the
noise.
machine.
Depends.
The new ones are pretty quiet.
Yeah. But another thing we try is relaxation training. So even chamomile tea or a nice hot bath before you go to bed. And I did learn keep clutter out of the bedroom as much as possible because believe it or not, that keeps us up. Your alarm clock, turn it the other way. Stuff like that, just those simple things can help.
Yeah, usually they say if you can't sleep, to get up out of bed, don't sit in bed with your phone. Get up out of bed, go read a book or a magazine that you've read before, one that you are familiar with. It helps you, you're not going to be engrossed into the story because it's a new book to you. Read something you've read over and over, helps you get tired and then go try and lay back down again.
Thanks. And no computers. That's bad on your eyes. Remember, the sleep cycle is for your eye. You want to keep your eyes in the darkness before bed. Snoring, it's a partial blockage of your airway. We all know what snoring sounds like, I bet, in this room. It says that back in 2003, 37 million experienced this on a regular basis, but 90 million have snoring. Males are, in this particular slide, they say males, those who are overweight with large necks are most at risk. That is yes, but we see women that are 120 pounds that have a sleep apnea index, like a guy that has a neck size of a 22-inch neck. You know what I mean? So it just really depends now. I think if you're not sleeping, you want to get that looked at. Loud snoring can be a symptom of sleep apnea, and it can be associated with high blood pressure. So all sleep apnea is a disruption or a obstruction of airway getting down to your lungs to breathe, and it causes arousals in your sleep. So you're waking yourself up. It's like a fight and flight symptom. 18 million, mostly males, those who are overweight, have high blood pressure, and persons with upper airway physical abnormalities. And like I said before in this slide, I would have to disagree with that because yes, males are more often, but women are seen just as much.
It has a lot to do with your airway anatomy too. If the doctor looks down your throat and the tissue, you don't have a big airway, you're going to be more prone for sleep apnea.
Yeah.
I room probably as many women as I do men.
Not bad.
What'd you say?
I room as many women as I do men.
Yeah, I mean, it's really, and I think women are getting more aware of that and wanting to get down to the bottom of why they're not sleeping.
And I think women go to the doctor easier, almost go to the doctors easier than
They
most
do.
men too.
Yeah, back in the day, women never admitted that they snore either. You told your story, you're like, no, women don't snore.
We still
So there's
do
some
that.
deniability too.
Back in the day.
Yeah, I still tell my husband I don't snore.
Yeah, my husband wants to record me, so it's like, go for it.
My dad has done that before.
Oh, really?
Oh, yeah. They've recorded each other, so
Oh, how
it's all
funny.
true.
That's funny. So treatments to sleep apnea. We have behavioral therapy. One really positive thing is to not drink alcohol or nicotine, or you know what, believe it or not, sleep medications also can cause sleep apnea. What sleep apnea also is, it's your neck muscles, okay? When you fall asleep, you relax. Same happens with your upper airway. It relaxes, and if it's, if you're sleeping on your back or even on your side, wherever you're sleeping on, your neck tissues, your muscles relax, and it obstructs that airway. And so it could be partially obstructed, it could be fully obstructed. The fully obstructed, it actually makes you jump up and gassed. Yeah. So we ask people to lose weight if they're overweight. That's not so easy, as we all know. But the physical and mechanical treatment we use is CPAP. That's the mask, that's the machine. You don't see the machine on there, but you see a mask. And that is a nasal mask. We have several masks in the market nowadays that are really nice for patients and easier for people to learn how to use this at night. They also have a dental appliance. A dental appliance is something that you wear, like a mouth guard you wear in the middle of the night, and it pushes your jaw forward so that it keeps that airway open. Now, those dental appliances are great, but they don't always work. So, and they're not all of them are covered under insurance. So if you ever get tested for sleep apnea, you really want to get some good evidence on how those appliances work. And then surgery, we really don't recommend that. That's the last thing we recommend. It's very, very painful. But then you have people that don't want to use the CPAP machine. They don't want to have the oral appliance. They're just like, I just want this done. Please get surgery. I don't know. I know you techs see this a lot where they come back.
Yeah. The surgery is basically where you go to an ENT, and if you don't have your tonsils, they'll take your tonsils out, your adenoids.